Hello, I am Dr. Khalilah Jefferson, DNP. Let's discuss cultural competence, the care you don't see, but always feel. As a nurse practitioner, I've learned something early in my career that no textbook fully prepares you for. Two patients can have the same diagnosis, the same treatment plan, and the same provider, and still have completely different outcomes. Why? Because of something we don't always measure: cultural competence. Cultural competence is the ability to understand, respect, and respond to a patient's cultural background, beliefs, and lived experiences. And in healthcare, it's not optional, it's essential because every patient walks into the room with more than symptoms. They bring their beliefs about illness, their experiences with the healthcare system, their fears, their values, their traditions. And if we don't take the time to understand those things, we risk missing the whole picture. Let me give you an example. You prescribe a medication, it's evidence based, it's appropriate, but the patient doesn't take it, not because they're non compliant, but because no one asked, can they afford it? Do they trust it? Does it align with their beliefs? Cultural competence shifts that conversation. It moves us from asking, why aren't they following the plan, to asking, did we create a plan that works for them? And the impact is real. Research shows that when patients feel understood and respected, they are more likely to follow treatment plans, engage in care, and have better health outcomes. Because trust is built, not assumed. And trust is everything in healthcare. Without it, patients delay care. They avoid follow up. They stay silent when they should speak up. But when cultural competence is present, patients feel seen. They feel heard. They feel safe. And that changes everything. So, what does this look like in practice? It's not about knowing every culture. It's about being curious, not judgmental, asking open ended questions, listening more than speaking, checking our own biases, and most importantly, meeting patients where they are. Because culturally competent care is not about changing the patient, it's about adapting the care. As nurse practitioners, we are in a unique position to lead this change because we don't just treat disease, we care for people. And when we understand the person behind the patient, we don't just improve outcomes, we transform care. Thank you.